Hello guys, today we'll talk about the shock index. So what is the shock index? The shock index has been discovered in 1967 by Algover et al. The purpose of shock index is to provide a tool to identify the patient developing a cold shock or the patient who have reached a limit of their compensatory phase. Historically, it has been used in trauma patient and in suspected sepsis patient. So how to calculate the shock index? It's quite simple. Heart rate divided by systolic BP. For example, if you take a heart rate of 60 and systolic BP as 120, I know it's a very common number, the shock index will be around 0.5. So we'll come to the range values. That is, the shock index from 0.5 to 0.7 is normal, from 0.8 to 0.9 is a risk for compensation, and if the shock index is 1 or more than 1, is a critical and the patient needs immediate care. I'll tell you two examples, a patient A and patient B. In patient A, if the systolic BP is 105 and heart rate is 65, so what will be the shock index? So if we divide 65 into 105, it will be around 0.6. In patient B, the systolic BP is 120, the heart rate is 120. What will be the shock index? I know it's 1. So commonly, if patient comes with a low BP, our intention will go towards the low BP one. And in this case, the patient B has a systolic BP as 120 and a heart rate as 120, so the shock index is 1, which I said before. So in patient B is normal systolic BP, but the patient doing the doubling the work, which means he is compensating a lot. And eventually that compensatory reserve has come to an end and that patient is going to attack. So that's what is shock index. Thank you.